Thank you so much for all the support you gave me, guys.
Okay.
Today, I got promoted.
Those who spread goodness radiate happiness to everyone around them. Introducing LOLC Finance Credit Cards. Fuel the goodness in you.
Welcome to LMDtv. This week on Talking Business, Anushan Selvarajah speaks with the Managing Director of Technomedics International, Linus Jeganathan, on the country's vaccine rollout.
Welcome to LMDtv, Linus. Good to have you with us.
Good evening to you, Anushan.
So what would you say are the biggest challenges in terms of rolling out the vaccine to our entire adult population?
I think now it seems like the biggest challenge is to ensure that we get the required number of supplies for the vulnerable groups. So if you look at the required number varies from time to time. So sometimes it's in the order of 18 million, 20 million doses. So in a nutshell, I see that given the fact that we need to vaccinate about 70% of the people, it might take a good 1.5 years or even 2 years, depending on the availability. So we feel that the biggest challenge would be sourcing, and the immediate priority would be to place the orders and book your stock. Then the other challenge that I see is, of course, we've taken a decision to go down the Indian AstraZeneca route, so which is a very wise thing, given the proximity, and also the pricing elements are quite attractive. And also storage and logistics are on a positive note. So all these are moving towards the positive side, but placing the order and getting the vaccines even in stages, that's the priority as of now.
Now there is some confusion in terms of the second dose that people are supposed to take as the timelines in between doses. What's your take on that?
So originally we were targeting about 3 weeks to 4 weeks, depending on the brand of vaccine that we would select. But subsequently, I think we might have learned a little bit from the rollout that happened in the United Kingdom, where they said that let's vaccinate as much as possible, and let's start with the first dose, and let's wait for about 12 weeks. So I have a strong feeling from what I've heard that we might go down the 12-week route. It's just a sense for the second dose.
Linus, what are your thoughts on the country's rollout of the vaccines? Have we done a good job?
Well, my biggest worry is not sticking to the original plan. Had we stuck to the plan that was proposed by the officials and a national rollout was planned in a systematic fashion, a lot of heartbreak and doubt and issues like that could have been avoided, because the original plan included the healthcare workers, the frontline healthcare workers, the armed forces, and also the above 60s to start with in a nutshell. But during the rollout, I think there have been many areas that were missed, a lot of miscommunication. So we got to get this act right.
Where do you stand on the vexed question of whether the over 60-year-olds should be given the vaccine first because they're more susceptible to the virus, versus the 30 to 59 age group who are the super spreaders and make up the bulk of our workforce?
Well, if you look at the way the country has progressed and the economic impact that it had, especially in 2020, I feel that the current priority is to look at our working force. If above 30 is what was recommended, let's stick to the 30 plus group and ensure that our working population is protected so that the economic impact doesn't worsen beyond what it is now. We have serious commitments this year. Tourism has hit a lull. All the hotels have been just shut down and they are barely trying to survive, They're looking at the local, what do you call population. But all this being said, I think the immediate priority is to look at the Western province and look at all the businesses so that they are secured first. I have no bias against the older folks, but as a nation, the priority should be focused on the working population.
We'll go in for a short break now.
Our story is one of reimagining. Reimagining who you can be, what you can achieve, and how SEMA can support you. As technology and digital platforms disrupt businesses, we are reimagining what the profession can be. We've updated our syllabus to meet the expectation of employers, ensuring SEMA-qualified professionals have the skills to make an impact from day one. Reimagine your career. Contact SEMA Sri Lanka.
Welcome back to the show as we continue our discussion with the Managing Director of Technomedics International, Linus Jeganathan. Now, the State Minister of Health recently said that even though you do get the vaccine, it does not mean that you won't contract the virus or that you would not pass it on to others, and that we have to follow through with the existing health regulations. Would you agree with that statement?
Certainly, yes, because what the vaccine will ensure is it will prevent the person from getting the severe symptoms and in worst scenario, prevent death. So that being said, so we are only mitigating the risk and the impact on the body. And the second thing is, whether you like it or not, we need to continue to wear our masks, maintain the social distance, and ensure that all our hand washing practices are continued. And especially with children and other vulnerable groups, we need to bear this in mind, because unless we do this, even the vaccinated lot might become carriers, affecting the lot which is not vaccinated.
Now, you did mention that it may take another year or a year and a half to reach that herd immunity. But don't you think that with the number of vaccines that are yet to come to us from the COVAX facility and other donors, that we will be able to reach that goal sooner rather than later?
Yes, with a lot of help from WHO and the other groups, I have a feeling if the stock reaches us quickly, given the fact that we are a small country with 9 provinces and 25 districts, it's quite easy to roll it out through our MOH system. Our hospitals are all geared, our healthcare workers kind of know what to do, because we have a very robust vaccination program. If you look at our national program, it's a very, very effective program. We've managed to eradicate polio and various other diseases. So that's a good thing. So we are equipped. It's just that we got to use this national infrastructure. So I feel no sooner we get the stocks, this can be rolled out.
Now, as you did mention, we are using the AstraZeneca vaccine at this point in time, but orders have been placed for Pfizer and Sinopharm, and maybe a few others are also in the pipeline. But wouldn't the varying efficacy rates of these vaccines, plus the time differences between doses, wouldn't that affect the effectiveness of a vaccination program?
Well, if you look at the data that has already been published, they are talking about 70 to 90% on efficacy. So I think most part of the vaccines will come through AstraZeneca, given the storage conditions being 2 to 8 degrees. But having said that, looking at the experience that US and UK have had over the last few weeks, I have a feeling technically the second dose may come from the same vaccine manufacturer. So there's a 90% chance that that will be the case. And there's nothing to prove otherwise that it will not be as effective if you take it from a different manufacturer. Okay. But the worrying factor is whether the efficacy will still hold true with the other variants that are emerged, the UK and the South African variants, and also the Brazilian variant. Specifically, I think we are very much exposed to the UK variant. So that being said, if that proves to hold true, then subject to all these mitigation steps that we have taken, we might still stand to emerge, hopefully in a year and a half.
Linus, what is your take on the one-hit wonder, so to speak, the Johnson & Johnson vaccine, which is Sri Lanka has professed some interest in getting?
Learning from the United States, I think they are registering J&J as the third option. And given the fact that it's a single shot vaccine, could be stored at 2 to 8 degrees once again. So that presents a very good opportunity for developing countries like us. So as of now, given the fact that the US FDA would be endorsing it soon, I think they may have already done it. And if that is the thing, and if that is the third option for US, then we might also stand a chance to benefit from that learning. So we, along with the officials even at NMRA, are quite excited about this option.
Now you mentioned the cost, Linus. Now, apart from the vaccines that we are getting from various organizations and other countries as well, we still have to buy a large portion of the vaccines that we need. Do we have the money to do that?
That's a very, very big challenge, I would say, apart from placing the orders. And the next question will be, given the global demand, they might expect us to pay for it when it comes to reserving those numbers that we want. As of now, it's a very, very big struggle. So we need to depend on the various funding lines, the donor agencies like UNICEF, UNOPS, and the WHO as well. So they've supported us in the past with the screening program, with PCR test kits being supplied through the donors. So I think as a short-term measure, we need their support.
As a final question then, Linus, do you believe that the vaccines should be given free of charge to all our citizenry? Or do you think that there would be a time soon where you would have to pay for your vaccine dose?
I personally feel that if they have addressed the vulnerable groups, most of the corporates who are earning for the vaccine, because many of the private sector, employees want it, be it the garment factories, the manufacturing setups. So the overall cost per person is quite low. We are not asking for a lot. So I have a feeling, given the challenge that the government also has getting the required funds, it is an extremely wise thing to ensure that some amount of it is sponsored by the private sector, or even as individuals, those who can afford. So in that way, the vaccine can be brought a lot quicker, and then we can ensure that the businesses can run in an uninterrupted fashion.
Some interesting points of view there. Linus, thank you very much for joining us on the show. It was a great pleasure.
Thank you so much, Anushan. All the very best.
After a short break, Ashwini Vethakan will bring you a roundup of local news. Stay tuned.
Welcome back to the show. I'm Ashwini Vethakan, and here's a roundup of local news. As of this week, the total number of COVID-19 infected patients in the island currently stands at 83,870, with the total number of recoveries reaching 80,437, and the number of fatalities now stands at 483. According to the Epidemiology Unit of the Ministry of Health, a total of 441,976 Oxford AstraZeneca Covishield vaccines have been administered. Meanwhile, Sri Lanka is ready to consider a single-shot vaccine that has been given approval in the US. Health Ministry sources have stated that if the vaccine is given approval by the local regulator, it will be considered. The vaccine is said to be cost-effective and can be stored in refrigerators instead of freezers. However, so far the National Medicines Regulatory Authority has not received an application seeking approval for the single-shot Johnson & Johnson's coronavirus vaccine. While saying that they were able to repatriate around 2,400 Sri Lankans since January, the Embassy of Sri Lanka in Saudi Arabia stated they have a growing waiting list of another 1,800 people. The embassy added that the country has prioritized the most vulnerable categories, such as people who need urgent medical attention, students, and the elderly to be included in the flights. In business news, financial markets are expected to become more proactive to support growth ambitions of the government. The relationship between the private sector and the government was envisioned as being a coordinated, growth-oriented approach, and as such, the central bank has said it will continue to maintain liquidity in the markets. The land valuation indicator for the Colombo district increased by 4.6% on a year-on-year basis to 145.2 during the second half of 2020. However, the degree of the LVI's increase was in line with the declining trend observed over recent periods. In addition, the LVI recorded an increase of 2.5% for the second half of 2020 compared to the first half of 2020. Sri Lanka's apparel exports got off on a gloomy start in 2021, with export earnings recording an 11% decline in January, which is below the $400 million mark, as constant COVID-19 related disruptions undermined buyers' confidence concerning the timely delivery of export orders, combined with growing competition. In January, apparel export earnings hit a 5-year low of $397.61 million, down 10.74% year-on-year, according to export figures released by the Joint Apparel Association Forum Sri Lanka. According to the industry's sources, it has seen its delivery on time falling to around 65% from 90 to 95% with the second COVID-19 wave in October, which has damaged the country's reputation as an on-time exporter among buyers. Meanwhile, the formula for payment of compensation to workmen has been increased from 1.25 million to 2.5 million rupees. The Commissioner General of Labour amended the sum of compensation paid to employees under the Termination of Employment of Workmen Special Provisions Act through an extraordinary gazette dated the 25th of February. And finally, the Fisheries State Minister has initiated a project to create an environment for fish breeding by using discarded buses and fishing vessels by submerging them into the seabed. The Ceylon Fisheries Corporation, Fisheries Department, National Aquatic Resources Research and Development Agency, and the Navy jointly coordinated this project. That's all we have for you this week. Don't forget to subscribe to our YouTube channel and follow us on Facebook and Twitter. Thank you for watching and stay safe.